Most certainly, there has been significant advance in the medical treatment of patients with peripheral artery disease, and this has actually given us great hope for opportunities for treatment. When we think about the treatment of patients with PAD, there's really two aims. One is to improve their physical functioning so that they can walk and do what the things they want to do. But the other one is to reduce their risk of major cardiovascular events like heart attacks, strokes, and death. Most of the medical treatment that we have available has been extrapolated from other vascular beds, namely coronary literature. And so the major mainstays have been antiplatelet therapy with aspirin, antihypertensive therapy, diabetes control, lipid control, and smoking cessation. All of those remain incredibly important today. But we have seen some advances in some other therapies that have entered into the field. One of the big blockbusters for us has been this development of PCSK9 inhibitors for cholesterol treatment. And that's because we have found through the FOURIER trial that in patients who are treated with maximal statin therapy and then who receive a PCSK9 inhibitor on top of it, their mortality rates drop quite dramatically. And we haven't had that literature in the PAD space. So that's a very exciting adjuvant treatment for us for our PAD patients. Secondly has been the COMPASS trial and the use of rivaroxaban and aspirin, rivaroxaban in a lower dose than what we would commonly use for the treatment of either stroke prevention and non-valvular atrial fibrillation or for deep vein thrombosis or pulmonary embolus. So this is 2.5 milligrams a day in combination with aspirin, has showed a prolongation in life in patients with PAD. And that's actually received an FDA label now in the United States. So it's another adjuvant therapy for us to put with our patients with PAD so that we can keep them alive longer. The third big change has actually been in diabetes care, and there's been the development of empagliflozin, which has demonstrated that in patients with diabetes and PAD, they live longer on that diabetes therapy. And we have not had that information in PAD either. So as you can see, in the big three areas, all looking at survival, we have some adjuvant therapies that could really change the way we take care of patients with PAD. I would view these medical advances as associated or adjuvant treatments to devices, not replacing devices. And the reason I say that is none of these are actually designed to make patients with claudication walk farther or have lower leg pain. That's not really their goal. What they've demonstrated is a survival benefit, which frankly is really of great value to our patients. So I could see really effective devices in combination with much more effective medical therapy getting patients to function better. That way they can exercise more. That will in turn reduce their cardiovascular risk factors like cholesterol, high blood pressure, body weight, and then with these other therapies keep them alive longer. Well, I'm very excited about the future. So obviously from a medical treatment standpoint, if you had asked me this 2 years ago, I would have said, there really isn't that much new happening. So now that's not the case. And I think with things like genomics and proteomics, we're going to continue to see medical therapy really playing a role in keeping patients alive and healthy longer. I'm also excited about the development of newer technologies that may in fact make the procedures easier to do with devices, maybe in fact ultimately getting to the holy grail of a device that's placed in the short term that resorbs over time so that there's no foreign body left behind. And that it's my hope that they'll become less expensive and more durable so patients will have fewer procedures but live longer and function better.